All right, today we're going to talk about a health signal that millions of people get, but honestly, very few really get what it means. It's called prediabetes. And it's not just some warning sign, it's a critical choice, a crossroads where you actually have all the power to decide what happens next. Just look at this number for a second. By 2035, experts think that 592 million people around the world will be living with diabetes. I mean, that's not just a statistic, that's a massive global health crisis. But here's the thing. For most of those people, it absolutely doesn't have to end up this way. So you have this giant global problem. But how does it become your problem? Well, for almost all of those 592 million people, the path to type 2 diabetes starts way, way before they ever get a diagnosis. It begins at this crucial crossroads, a point where you can literally change direction. It starts with prediabetes. Okay, to help you make sense of all this, we've put together a little roadmap. We're going to start with the big picture, then zoom right into what's actually happening inside your body. We'll talk about the real dangers of just waiting around, but more importantly, we're going to show you the powerful, proven steps you can take to get back in the driver's seat. Ready? Let's dive in. So now that we see just how huge this problem is, let's focus on the one thing that can change everything, and that's really understanding the warning signs. Because, when we know what to look for, we can actually take back control. So let's get into it. You've got to forget everything you think you know about prediabetes. Seriously, it's not a disease, it's a message. It's your body sending you a super clear signal that, hey, it's time to pay attention. It's your chance to make a change before things get serious. You know what it's like? It's basically your body's check engine light. Now, when that light pops on in your car, you don't just ignore it and hope it goes away, right? Of course not. You take it to get checked out. Well, it's the exact same idea here. Prediabetes is just a signal that it's time to look under the hood and make a few tweaks. And the best part? You've already got all the tools you need to fix it. So how do you even know if your check engine light is on? Well, it all comes down to the numbers. A simple fasting blood test tells the whole story. If your number is below 100, you're in the clear. That's the green zone. If it's 126 or higher, well, you've crossed over into the red zone of diabetes. But that zone in the middle, from 100 to 125, that's the yellow light. That's your pre-diabetes warning.
So what's actually causing this? What's going on under the hood? Well, it's this thing called insulin resistance. Let's make it simple. Imagine every cell in your body is a little house, and sugar is the fuel it needs to keep the lights on. Insulin, that's the key that unlocks the door to let the sugar in. But with insulin resistance, the locks on those doors start to get kind of rusty. The key doesn't work as well. And what happens? The sugar gets stuck outside, in your bloodstream, and your levels start to creep up.
But what if you just ignore that flashing light on the dashboard? What if you just keep on driving? Well, that's when things can get pretty serious. Because prediabetes isn't just a number on a chart. It's a sign that real damage could be happening inside your body right now. Okay, if you only remember one thing from this whole explainer, let it be this. The damage we all associate with diabetes, to your heart, your kidneys, your nerves, it doesn't just magically appear the day you get a diagnosis. It starts quietly, silently, during the prediabetes stage. Yeah, don't let the pre fool you. Even having your blood sugar just a little bit high can cause some serious problems. It can damage the tiny blood vessels in your eyes and kidneys and even the big ones that lead to your heart. In fact, get this, studies show that almost 1 out of every 5 people with prediabetes already has signs of kidney disease. This is not some harmless waiting room. It's a major call to action. Okay, I know that all sounds a little scary, but here's where the story takes a turn. Here comes the really, really good news. Prediabetes is not a life sentence. It's a crossroads, and you get to choose which path to take. And you know what? The path to prevention isn't just possible, it's been proven over and over again. And hey, this isn't just some hopeful idea. It's a scientific fact. A huge review of all the research came to this conclusion, and I'm quoting here, clinical trials have demonstrated that it is possible to prevent diabetes through lifestyle modification. Just let that sink in for a minute. We have the power to change our own story. And the proof is right here in the data. These huge landmark studies found that simple lifestyle changes can have a massive, massive impact. And we're not talking about anything crazy here. We're talking about things like a little more exercise, making slightly healthier food choices, losing a bit of weight. For people with prediabetes who did these things, they cut their risk of getting full-blown diabetes by an incredible 58%. Look at that. That's way better than the leading drug metformin. 58%. I mean, let's just pause on that number. That's not just a statistic. That is a huge testament to the power of our daily choices. You can cut your risk by more than half, not with some magic pill, but with simple changes you can actually stick with. Now that's empowering.
So, you decide to take this new path. How do you stay on track? Well, you need a good dashboard to see how you're doing. Let's look at a couple of key tools that you and your doctor can use to make sure you're heading in the right direction.
First up is something called the A1C test. Think of it like a report card for your blood sugar. You know, checking your sugar daily is like a little pop quiz. It tells you what's happening at that exact moment. But the A1C, that gives you the big picture, your average score over the last 2 or 3 months. It's the perfect way to see if all your hard work is actually paying off. But listen, it's not just about keeping your blood sugar from getting too high. You also have to make sure it doesn't drop too low. And that's a condition called hypoglycemia. It can be pretty dangerous. The best way to think about it is like your body's fuel tank is running on empty. It's a really important piece of the puzzle and something you definitely need to be aware of, especially if you're taking certain medications. And there are different warning levels here too. Level 1 is like a yellow light. Your sugar's low, time to grab a snack. Level 2 is a red light. You're in the danger zone and you need to act right away. And level 3? Well, that's a real emergency. Your mind or body isn't working right and you're going to need someone else to help you. Knowing these levels helps you stay safe and stay in control. So, what's the bottom line here? We've looked at the giant global crisis. We've decoded the warning signs from our own bodies, and we've seen the incredible, proven power of prevention. Now, it's just about putting it all together. Prediabetes is not your final destination. It's a fork in the road. It's a clear signal, giving you the chance to grab the steering wheel and point your health in a brand new, better direction. You are in control. You have the power to decide what comes next. So, I'll leave you with this question. What are we going to do with this knowledge? We know, for a fact, that we can prevent diabetes. We know that a 58% risk reduction is totally possible. So, what's the very first step we need to take together, in our communities, to make that a reality for everyone?